Welcome friends, I am Dr. J.P. Das, Principal of National Institute of Medical Science and Director of Mousumi Hospital. Today we shall discuss with a very important topics, psoriasis. It is a skin disease and lots of people in this world suffer from serious type of skin disease. It is very much painful. We shall discuss today about the psoriasis, its symptoms and the treatment. Let's start the video. Psoriasis is a common long-term disease with no cure. It can be painful and interfere with sleep and make it hard to concentrate. The condition go through cycles and flaring into few weeks to months. Psoriasis is a common long-term chronic disease with no cure. It can be painful, interfere with sleep, and make it hard to concentrate. The condition tends to go through cycles, flaring for a few weeks or months, then subsiding for a while. Common triggers in the people with genetic predisposition to psoriasis, including infections, cuts or burns, and certain medication. Treatments are available to help you manage the symptoms, and you can try lifestyle habits and coping strategies to help you live better with psoriasis. Common sign and symptom of psoriasis includes a patchy rash that varies widely in how it looks. It differs person to person, ranging from spots to dandruff, like scaling to major eruption over the body. Rashes that vary in color, tending to be shades of purple with gray scale on brown or black skin, and pink or red with silver scales and white skin. Plaque psoriasis is the most common types of psoriasis. Plaque psoriasis causes dry, icy raised skin patches covered with scales. There may be few to many. They usually appear on the elbows, knees, lower back, and scalp. The patches vary in color depending on the skin color. The affected skins might heal with temporary changes in color. Post-inflammatory hyperpigmentation condition is called this, particularly on brown on black skin. Psoriasis is thought to be an immune system problem that causes the skin cells to grow faster than usual. In most common types of psoriasis, known as plaque psoriasis, this rapid turnover of cell results in dry and scaly patches. Many people who are predisposed to psoriasis may be free of symptoms for years until the disease is triggered by some environmental factor. Common psoriasis triggers include infections such as strep throat or skin infections, weather, especially cold and dry condition, injury to the skin such as cuts or scab, a bug bite, or a severe sunburn, smoking and exposure to the secondhand smoke, heavy alcohol consumption, certain medication including lithium, high blood pressure drugs, and antimalarial drugs, rapid withdrawal of oral and injectable corticosteroid. Anyone who develops psoriasis, about a third of instances begins in children. This factor can increase the risk of developing the disease. The condition runs in families. Having one parent with psoriasis increases your risk of getting the disease, and having two parents with psoriasis increases your risk even more. Smoking tobacco is not only increases the risk of psoriasis but also may cause the severity of the disease. If you are having psoriasis, you are having greater risks of developing psoriatic arthritis, which causes pain, stiffness, and swelling in around joints. Temporary skin color changes where plaques have healed. Eye conditions such as conjunctivitis, blepharitis, and uveitis. Obesity, type 2 diabetes, high blood pressure, cardiovascular disease, and other autoimmune diseases such as celiac diseases, sclerosis, and inflammatory bowel diseases called Crohn's disease. Mental health conditions such as low self esteem and depression. Psoriasis treatment aims to stop the skin cells from growing so quickly and to remove scales. Option includes creams and ointments, light therapy, and oral and injected medication. The treatment you use depends on how severe the psoriasis is and how responsive it has been to previous treatment and self-care medication. Corticosteroid drugs are most frequently prescribed medication for treating mild to moderate psoriasis. They are available on vials, ointment, creams, lotion, gels, foams, spray, and shampoos. Mild corticosteroid ointment, that is hydrocortisone, are usually recommended for sensitive areas such as face or skin folds for treating widespread patches. Topical corticosteroids might be applied once a day during flares and on alternative day or weekends during remission. Synthetic forms of vitamin D such as calcipotriene, whose brand name is Dovanax, and Sorilux, and calcitriol, whose brand name is Bactrical, slow skin cell growth. This type of drug may be used alone or with topical corticosteroid. Calcitriol may cause less irritation in sensitive areas. Calcipotriene and calcitriol are usually more expensive than topical corticosteroid. You can use retinoid, calcineurin inhibitors, and salicylic acid, coal tar, and anthraline, etc. Light therapy is a first-line treatment for moderate to severe psoriasis, either alone or in combination with the medication. It involves exposing the skin to the controlled amount of natural and artificial light. Repeated treatment are necessary. Talk to your healthcare provider. Home phototherapy is another option for you. Brief daily exposure to sunlight might improve psoriasis. Before beginning to a sunlight regime, ask your healthcare provider about the safest way to use the natural light or psoriasis treatment. Goikarman therapy is an approach that combines the coal tar treatment with light therapy. It's called Goikarman therapy. This can be more effective because coal tar makes the skin more responsive to the ultraviolet B light. If you have moderate to severe psoriasis or other treatment have not worked, your healthcare provider may prescribe oral or injected drugs. Some of these drugs are used for only brief period and might be alternated with other treatment because they have potential for severe side effects. They can prescribe you steroids, retinoids, biologics, methotrexate, and cyclosporine. Other medications are trioguanine and hydroxyurea. If your healthcare provider will choose a treatment approach based on your needs and types and severity of your psoriasis, you will luckily start with the mildest treatment, topical creams and ultraviolet light therapy. Then, if your condition does not improve, you might move to stronger treatment. Some studies claim that alternative therapies, products, and practices not part of the conventional medical care or that develop outside the traditional Western practice ease the symptom of psoriasis. Taken from the leaves of aloe vera plant, aloe extract cream may reduce scaling, itching, and inflammation. You might to use the cream several times a day for a month or more to see improvement in your skin. Oral fish well therapy used in combination with the UVB therapy might reduce the extent of rash. Applying fish oil or to the affected skin and covering it with a dressing of 6 hours a day or 4 weeks might improve scaling. Oregon grape is also known as barberry is applied to the skin may reduce the severity. You have to try some lifestyle care measures to better manage the psoriasis. Wash gently rather than scrubbing your skin in the shower or bath. Use lukewarm water and mild soaps that have added oils and fats. It might help to add bath oil, Epsom salts, and oatmeal to bath water and soak it for at least 15 minutes. Apply moisturizer daily. If you are moisturizing after bathing, gently pat dry and apply your preferred product while your skin is still moist. For very dry skin, oils or heavy ointment based moisturizer may be preferable. They stay on the skin longer than creams or lotion do. Before going to bed, apply an ointment based moisturizer to the affected skin and wrap the plastic with plastic wrap. When you wake, remove the plastic and wash away scales. Ask your healthcare provider about the best way to use the natural sunlight to treat your skin. A controlled amount of sunlight can improve psoriasis, but too much sunlight can trigger or worsen outbreaks and increase the risk of skin cancer. It might help to apply a non-prescription anti-itch cream or ointment containing hydrocortisone or salicylic acid. If you have scalp psoriasis, try a medicated shampoo that contains coal tar. Notice that triggers of your psoriasis and take steps to prevent or avoid it. Infections, injuries to the skins, smoking, and intense sun exposure can worsen psoriasis. Being too hot can make your skin feel itchy. Wear light clothing if you are outside on hot days, or if you have air conditioning, use it on hot days to keep cool. Try practicing other healthy living habits to help manage psoriasis. This includes active eating well and avoiding alcohol consumption and maintaining a healthy weight. Friends, we have come at the end of the video. I hope you have learned about psoriasis and you will be able to treat the psoriasis. very nicely. And I hope you have liked the video. If you have liked the video, please give a like. If you are new in this channel, please subscribe it, such that we can produce more videos, such informative videos for you, and it goes to you very fast. However, we shall see you again in the next video, which will come very soon. Until then, bye bye.